And here you go. If you want to buy one, you can actually get an animatronic psychiatric chair. Comes totally included with the patient straitjacket locked to a chair. But this is just a prop. This actually did happen. Being bound to a chair was nothing new. You'll see this practice in all kinds of torture techniques on television shows. However, the biggest difference was this was actually happening. And this all happened over 100 years ago at a very alarming rate. Reported in a newspaper article published in 1886, a woman who was suffering from nervous excitement was taken to the state's insane asylum. While she was in the asylum's care, she was intentionally tripped and injured her left leg. She went to lie on her bed to recover from the injury, not knowing that it was against the rules of the asylum to do such a thing, and they immediately grabbed her up. A report had stated that she was placed in a chair and bound so tightly she couldn't move. The strap that went around her waist was so tight it stopped circulation, that she couldn't move, and she was left strapped up in this torture position from 9 a.m. to 4 p.m. And when she was unbound, her limb that was injured from the fall or being pushed over was swollen twice its normal size. She also endured gagging and having a large amount of her hair pulled out of her head by one of the attendants. So this is just a picture of a chair that they would have strapped you to, very similar to the one that this poor woman actually had to endure also many years ago. And again, real quick, if you or a loved one have anybody that you may know that's in one of these state mental institutions for psychological problems that they may be having, please check on them. As it was pointed out, these heinous crimes actually do take place in some of these psychiatric wards that we currently have, and things, unspeakable crimes happen there. So please make sure you check on your loved ones and your family members if you happen to have anybody that is currently in any of these institutions.